I think that's fine. Hey guys, I'm Jasmine.
I'm Cheryl.
We're from Advanced Modern Beauty, and we are back for our third episode.
Third? Oh. Wow, okay.
So today, we're going to be going over like pre-care and after-care of the services we do here, and like kind of what you can expect, like when you come in, like what to wear, like, you know, we all like leisure today.
Yes.
And all comfy. And just kind of like what you should expect when you come in to get your lashes done, when you get any kind of permanent makeup, skincare, etc.
Yes.
So we'll start with lashes.
Yes.
So a big thing I notice with my clients is a lot of people sometimes come in with their hair up, like they have like slicked back and stuff, and they get really uncomfortable when they lay back. So I always tell them make sure, like, you know, and they kind of get it after the first couple times, you know, then they start coming in with their hair down or their hair just in a low pony. It's really important to be comfortable, to wear comfy clothes. It's a relaxing service.
Yes. You'll be laying down for about an hour and a half, 2 hours maybe.
Yeah.
Or maybe 3, just in case what kind of sets you're getting or fills. But yeah, if you come in with pajamas, we're all good too. Pajamas is good.
Yes.
It's welcome.
Always be comfy. And this is not always possible for everybody, because I know some people of my clients, or some of my clients, some people come from work, some people come from school, you have makeup on. But as best as possible, your lash artist will very much appreciate if you can come in with nothing. Clean lashes. But of course, we know that's not always possible, so we will always wash your lashes anyways.
Yes.
Just to get all the extra oils and stuff off your face, right?
Yes.
Yeah.
Yes.
Yeah. So comfy clothes, no makeup if possible. If not, of course, we got you.
You don't have anything at all. Don't come in with full-blown eye makeup, because we will wash it off. Do not curl your lashes. No caffeine or any type of stimulant drink that makes you all jittery, because your eyes will flutter like a butterfly.
Yeah. That is depending on the person, though, because some people don't, which is like I do.
Yeah.
But I know some of my clients don't. Like they'll come in with like their coffee almost gone, and they're like.
Oh, okay, yeah. But if you're the type to jitter a little bit when you're drinking, or maybe if you drink coffee, if you don't know if you are that person, you drink your coffee, you close your eyes, and if you feel like your eyes is fluttering, like you're trying to sleep but you can't sleep, then that means caffeine is hitting you hard on.
No caffeine before the appointment, because we do not want to hook your eyes.
Yes, or try to like, and I think that's it for the pre-care.
Yeah.
Right?
And so for aftercare for lashes.
Actually, wait. Contacts.
Oh, yes. I had a client yesterday who had her contacts and her eyes were feeling dry.
Yeah.
Some people just kind of like push through it. It depends on the person, but it can like make your eyes kind of irritating and be kind of dry. Yeah. So we suggest not to.
We don't recommend contacts, but if you're comfortable to wear contacts during your lashes, that's okay too. Like I have a lot of clients that does wear contacts, but FYI, you're gonna feel dryness in your eyes. So
yeah. And then that's kind of going into the aftercare with the eye drops. I guess maybe no eye drops, but don't get your lashes wet for the first 24 hours.
Yes.
Always, because you know the glue is still setting in and drying. Yeah.
Yes.
No, don't put mascara over your lash extensions. Don't curl your lash extensions. Do not pull them. Don't pull your lash extensions. I'm guilty sometimes.
Yeah. Don't sleep on it. Don't rub it. If there's anything bothers you, let us know. Text
or let your artist know.
Or your artist, and it's like, hey, something's bothering me, and that's when your artist is like, okay, come on in. I have a few minutes. Let's check it out. Try not to fix it yourself, because again, it's your natural lashes. So natural lashes, once you pull them off, sometimes you don't grow back.
Yeah.
So you don't want to have a gap. So yeah, if anything, it just feels wrong or feels different or feels like it's off, text your artist.
Right, exactly. Yeah. And people always ask me like how to rub their eyes, because I used to love it. I can't remember it, but I always tell them just like right above the eyelid, you know, just like.
Oh, I go like this.
Underneath? Yeah, I know, because it's like cannot itch. Yes.
You can, but it's gonna be very, very uncomfortable.
Yeah.
Yeah. So it's not.
You probably don't want to be touching your eyelashes with your oily fingers.
Yes.
Yeah.
Yes. Oil is number one when it comes to
the reason they fall out
faster. Yes, it's oil, the sweat, and it's not just like products, oils from products, but it's also our natural oils in our sweats. So if you're working out, or if you're always like just sweaty and oily eyelid kind of type of person, you want to get a little bit of a tissue or a Q-tip, and just clean off your eyelids throughout the day.
Yeah, just kind of blot them.
Yes.
Yeah. And then we also, most lash artists, and we do too, we sell like lash baths.
Mhm.
So it's just like a little foam wash for your eyelashes. So when you are washing them, nothing with oil. Oil free, obviously, like she said, oil is like the
Yeah.
biggest reason why like the lashes can fall off faster. So don't use your oil-based cleanser on your
Yes.
lashes. We sell lash baths, and I always tell people if they don't want lash baths, you can get like just water and just make sure you like.
Yes, or a little bit of a Baby Johnson shampoo.
Yeah.
And this
yeah.
is also depending. So if you wear eyeshadow or eyeliner, which I don't think you need to because of your lashes, but if you still do, then we'd recommend washing your lashes every day.
Yeah, especially if we wear eye makeup. Yeah.
Yes.
Or even concealer and stuff over the eyelids.
Yes,
Yeah.
you don't want that build up on your extensions, because even though you feel like it's clean, us as an artist, we go in there and we see stuff, and then those are the things that can build up dust, build up any type of whatever is in the air on your makeup, and you don't want to get an infection in your eyes. So
yeah, absolutely not, because
that's
it can
number
irritate
one.
you. Especially like I noticed like concealer, like some of my clients wear like concealer,
yeah,
and sometimes they have like the residue, and it's very sticky. Like it'll make your lashes stick together. You don't.
yes,
Yeah. No, because we get in there.
yeah.
Like you see it from this far in your mirror, but we see it from like real close.
What is it called? Microscope.
Yeah,
Or
basically looking at
microscope.
your eyelashes under a microscope. Yeah.
Yes.
Yeah.
See, you like to bake, or you like to cook,
Oh.
or bat. You make sure it's not too steamy. In the oven, trying to put your whole head in there,
Because they will cinch.
it will cinch on the top, and you won't be able to brush it. Let's see what else. Oh, don't use a blow dryer or dry it either.
Oh,
That's
yeah.
like a lot of air pressure.
Oh yeah, and don't brush them while they're wet.
Yes.
Let them air dry. Just use a tissue to blot, or some people do get little fans. It's not necessary. You don't have to.
Yeah.
Just let them air dry, and then you can brush them out.
Yes. Because when you brush it when it's wet,
They clump.
they clump together
Because
anyway.
of the water, yeah.
Because the water
Yeah.
mix them together.
Yeah.
So yeah, it's just
Better
best to
to
like
just let them
air
air
dry
dry.
it. Yes.
Always.
And then I think that's about it for aftercare.
For lashes,
right?
yeah.
Oh, if you have little toddlers or babies, try not to get too close because they will grab you.
That would be so tragic.
I think I think one party we had there was a baby. I was holding a baby. I think she was like really looking at my eyelashes. She was like trying to grab my eyes. I'm like,
You're like, no, not the lashes.
I know. So you gotta be careful, like anything.
Yes.
So,
Yes. Absolutely. Yeah.
but I think that's about it for the aftercare for lashes.
Yes.
It seems overwhelming. It seems a lot, but like you'll get used to it,
Yeah.
and then you spend your time and then your money for your lashes, and you want to make sure you take care of it.
Yeah.
Or your boyfriend or husband or somebody like, oh, $1 just fell off the floor, or like $2 in the lash pillow,
Right. Exactly.
or on your bed or
Right.
something. But
Absolutely,
yeah, take care of your lashes. It's like great hygiene for your lashes and for your eyes too. So
Yeah, because you don't want the gunk that's stuck in your lashes to go like in your eyes and stuff. No.
no.
Just keep your lashes clean. That's,
Yeah.
that's the
That's
moral
it.
of the story. We're
Yeah.
going to talk about the pre-care and after-care for permanent makeup.
Oh yes. So permanent makeup is also as important with pre-care and aftercare as with your lashes. Pre-care. There can be a lot more with pre-care for permanent makeup. It's because it depends if you have you're taking vitamins, medications, if you can have surgery, MRIs, if you have any type of autoimmune disorder. What else? If you're taking blood thinners, those are the things that we as artists need to know. If you are on blood thinner, you can't be on it, but I can't recommend you to get off of it. You want to make sure you get your doctor's note for that. I can't prescribe you anything, or I can't say I need you to stop taking this because I'm not your doctor.
Right.
So the blood thinner, the reason for you to stop it for, I would say, a little bit of 48 to 72 hours is because once we cut open your skin, we don't want all that blood rushing out and removing that pigment that we're trying to implant into your eyebrows or to your
Right.
lips or to your eyeliner. caffeine 24 hours prior. That also stimulates your blood flow. And same thing with alcohol or an aspirin.
Yeah, it's a little more serious because with lashes, it's more serious, of course, it's on your eyes.
Yeah.
But this is like really in your skin. It's semi-permanent tattoos, you know.
Yes.
So anything that goes into your bloodstream, like she said, alcohol, caffeine, any kind of medication will affect your blood, of course.
Yeah. It will affect the outcome of the service. And of course, if you're pregnant or you're nursing, you have to be done with nursing and wait for, I would say, a couple more months after nursing to get your any type of permanent makeup or tattoos. I recommend is because your hormones, your body is still getting back into your regular self, you know. And so if you're like, okay, I stopped nursing today, can I get it done tomorrow? Like, no,
your body needs time to regulate.
Yes. So and same thing with when you're pregnant, just in case. And also it's, again, our hormones are going through a lot during those time, and then so you might not get the results that you would get if you are not in any of the medications, or if you're not pregnant. I mean, if you're pregnant or if you're nursing. But again, we won't do your eyebrows or your eyeliner or lip if you are under those contradictions.
Yes.
Of course, diabetes. If you're diabetic, it's also important to get a doctor's note to be okay with that. Because diabetes, if you're diabetic, it takes longer to heal. And also the result, again, is not, it might not be what you want it to be.
Right.
When it comes to if you are diabetic.
Right, or just under different circumstances. Because it's not just as simple as, oh, we're just going to tattoo your brows. Like, it's your blood, you know. It's like, really, it is going in your body. Like,
it's your body. Yes.
Yeah. So there are things
I think that's about it. And then, of course, if you are, for aftercare, if you are an avid exercise gym person, you cannot be in the gym, you cannot be out in the sun, you can't sunbathe.
For how long?
I would say for the sun, I would try to avoid the sun for the full 4 weeks of healing. The sun exposure, just minimize it if you're getting it done during the summer. Even during the winter time in the sun, you want to make sure you wear a hat or giant sunglasses just to avoid it. Definitely no products on your eyebrows.
Oh, yeah.
Until it's completely done healing.
Yeah, and do not pick the scabbing.
Oh, yeah.
Don't pick the scabbing.
Yes.
We've seen it happen a few times online and just like people in general. Like, I'm a big scab picker. I will admit that. I hate scabs because I will peel them right off. But if you peel your eyebrows, you got a big white eyebrow.
Yeah,
big
not
scar.
White. But just like you pick it off, if you're scabbing, you pick it off. Then of course you're gonna pull off that pigment too.
Yeah.
So with the first few days, it's gonna become dark. That's when your blood and the pigment oxidizes. So it's gonna look darker. Like, oh my god, my eyebrows are like black. You know, it's way darker than what you want. Don't worry about that. Between 3 to 5 days up to a week. Again, this is just a ballpark time because everybody heals differently. It's going to start itching, it's going to start scabbing, it's going to start kind of like a peeling blotchiness. And again, it depends on everybody. I have some clients who don't scab at all, who doesn't have any peeling, and I have clients that look like they got blocks in their eyebrows, you know. So it just depends. But during the process, you cannot touch it unless you're putting the ointment, and you cannot pick it off. Yes, you're gonna go through a series of emotions of how your eyebrows are gonna heal.
Yeah.
But that's why, again, like, before you make this appointment, make sure you're not going to a wedding, you're not going to a vacation, you're not having a family reunion or any type of event that you need to have your eyebrows like perfect.
Or people are really gonna see you if that's something you care about.
Yes.
Obviously, yeah.
And then after that peeling process is over, I would say up to 2 weeks, or it could be more or less. It's gonna look like you didn't the artist didn't do anything to your eyebrows. It's gonna fade.
Yeah. Yeah.
So that is normal. That is completely normal. And wait for another 4 to 5, maybe up to 6 weeks. Then all that pigment that stayed into your eyebrows will go up into surface.
Yeah. And that's also why we do a retouch.
Yes.
Yeah.
Just in case certain part of your eyebrows didn't like the pigment, or we need to adjust the pressure. As an artist, we have to adjust our pressure and how we implant the pigment. Again, the first time when we do your service, we don't want to make it too bold, too crazy. It's just because it's better to add more to it because we can't take away from it.
Right. Yeah. So like in your initial procedure, maybe you don't go as dark as like you may want, because again, like she said, you can always add, but you cannot take away.
Yes.
Unfortunately, yes. Once it's there, it's there. So
yeah. For your peace of mind that your eyebrows are not gonna be like, boom, it's black, or
right,
really deep brown, or whatever color, you know.
Too dark to come off.
So it's better to go softer the first time. Not too soft, of course. We'll try to match it as good as possible with your natural eyebrows, but definitely not too dark.
Right, because you have to trust the process.
Yes.
Trust the process and trust your artist, of course. Yeah.
Yes. And also with the shape and everything, like again, we're gonna go through everything, that the process of doing the service. Yeah. But we're talking about before and after care. Now we're going off to another subject.
Right. We can get more in depth in another video.
Yeah.
About just microblading or just permanent makeup. Yeah.
Yes. So skincare, for like the basic facial, of course, come in, relax, be comfortable. For the basic facial, after the facial, definitely moisturize, sunblock all the time, no matter winter, stormy, cloudy, black outside, just sunblock.
Sunscreen.
Yeah,
that just goes in general. You should always wear sunscreen.
Yes, it's very important. And then I'd say keep it, just maintain it, don't scrub it, don't use an exfoliator for the first few days. And that's basically the aftercare for basic facial. Lots and lots of water. If you are going to do any type of chemical peel, microdermabrasion, or dermaplaning, definitely just a little bit more gentle in the in caring for your skin afterwards. Lots and lots of water. Sunblock. Do not exfoliate or do not do any type of scrub in your face for I would say 3 to 5 days after getting all that surfaces done. But definitely for chemical peel, we do like chemical peels. You don't want to do any type of scrub for that. It's just gentle wash, lots of moisturizer, and lots of sunblock, because the peel is throughout the healing time. I would say up to 3 to 4 weeks, your skin will peel just a tiny bit, and that you can't peel off either.
Yeah, you just let it happen itself, because it's like getting rid of like the dead layers.
Yeah,
and so when like the baby skin comes out, you don't want to be too harsh on it.
Yes, it's very you want to like really take care of your skin.
It's very sensitive.
Yes. I would say microdermabrasion and dermaplaning is not as invasive when it comes to healing, but again, it depends on your skin.
Yeah.
If you have sensitive skin and you're getting all that service done, microdermabrasion and dermaplaning, you want to make sure you keep it moisturized, gentle wash, and definitely sunblock. Yes. I think that's about it.
Yeah.
And lots of water. Your water can be like your best friend.
Yes.
For any skin type, for anything, for every day, forever in your life.
Right. Water and sunblock.
Yeah. So sunblock I would recommend is 30 SPF and above.
Yes.
Yeah. Unless if you like really fair skin, then you want to try to go a little bit higher.
Higher the better.
Yes.
I think that pretty much covers what we're talking about today. I think this one was a little bit shorter, but we just thought it'd be important to like, just go over like, obviously we're talking about we do these services, but like what do you expect? What should I do after? What should I do before? Because sometimes it may seem simple, but there are a lot of things, especially with permanent makeup, I feel like that goes more into it, like with the blood thinners and all that stuff. Like there's more scientific stuff that goes into it than people might think, Because I feel like when you think of like kind of services like this, it's like, it's like beauty, it's like, self-care, but there are some like medical things, that come into play with it, especially, with blood and even with lash extensions and just being safe. And so,
But also, yes, it's not just your artist telling you. For us, we do have an aftercare kit and everything,
Yes,
and like
yes.
instructions to
Yes.
do and to help you out. Like if you have to refer back to, it's like, oh. Or of course, you can always text us,
Reach out,
like,
yeah.
hey, I forgot. Am I supposed to do this? Am I supposed
Right.
to do that?
Yeah.
And if you don't have that paper, but we always have the aftercare
Yes.
information that you can take home with you.
Yes.
Yeah.
Yeah.
But I think that's about it. Yeah. It's
So that's
important.
pretty much it for today, guys. We're gonna
Yes.
see you guys real soon. So we hope you have a great day or wherever you are, and we
Yeah.
hope you enjoyed today's episode.
Okay, bye.
Bye.